Have you been diagnosed with TMD and you have cracking and grinding in your jaw right here? You have inner ear pressure and your muscles always feel tight and achy. And you've done the splints, you've taken the muscle relaxers, you've had people get inside your mouth and do the massage work, and some of it works temporarily, but it doesn't get rid of the issue completely. And commonly what we find when they have these TMD issues, they also have several associated symptoms like ringing in the ears, some type of vestibular imbalance, whether that's vertigo or they just feel like every now and again they're on the ocean or a boat. And they also commonly have cognitive issues. And the reason these all tend to tie together is the underlying root cause of many of these problems is a structural problem right here at the floor of the skull. Inside of this vertebra and inside of the skull is a structure called the trigeminal nerve nucleus. Its job is to coordinate the muscles of mastication, these ones right here that help you chew. And when the top vertebra is structurally misaligned and irritating that nucleus, the muscles are going to become tighter on one side and the other. And where the TM joint fits, when it's tighter on one side and the other, it draws it out of balance, and that's where the cracking and grinding comes from. And there's also a nuclei in the cord here called the vestibular nucleus, which controls balance. And so it can be associated. And then there's a muscle in the inner ear called the stapedius muscle. It's a dampening muscle. And when that muscle is chronically spasmed, just like your shoulder muscles, it can reproduce ringing in the ears. So what's the solution? The solution is to get to someone who's specially trained in upper cervical chiropractic work, where they'll run you through tests to determine if you have a structural misalignment in the neck and where it is. Once it's determined you have a problem, a 3D image is taken that looks at how these two joints fit to the floor of the skull. And that allows the doctor to know how you're out of position. Once the direction is known, a precise correction is made with no yanking, twisting, or pulling on the neck to restore normal joint motion. Once that segment's in its normal range of motion, the structure of the body starts to return to normal. The neurophysiology starts to recover. The muscles of mastication tend to balance out. The balance improves, and overall the function of the body returns to as close to normal as it can, and you have better health. If this sounds like you, leave a comment in the comment section below. We can help you find an upper cervical chiropractor in your area.